You can be at home most of the time, sleep in your own bed, eat your own food. So there were a lot of attractions to having the treatment with the ambulatory care. My wife had to drive me, but for her, she would have been, if I'd been an inpatient, she'd have been coming in to see me most days anyway. So from her point of view, it didn't make a massive difference. And from my point of view, I was very happy to make the journey. It was well worth it. In order not to be an inpatient, I thought.
If you're going home every day, that means you're coming in every day. Now that will entail transport consideration, the time frame around rush hour and school hour traffic, who might even be bringing you into the ambulatory care unit each day. That is certainly a big consideration when having treatment in this way.
It was nice to be able to come home and the kids to be able to give me a cuddle, you know, each evening and stuff, and actually to be able to say goodnight to them as well. That was the main reason for not staying in hospital from day one, because a lot's happened in the last year for them as well as us. It was better, much better than being stuck in hospital, definitely.
You will still experience side effects of treatment, and you would still experience some level and some degree of fatigue. Other aspects of care that you might want to consider are the responsibility on family members or young children or carers that are at home. I think there's a sense of, once you're in hospital, there's a handover of responsibility for some families, for some carers that may be otherwise absent if you're going home each day.
The hours that the ambulatory were open, I could phone them if I wasn't obviously there, so if I'd come home or whatever. Triage at the Churchill, I could always phone them if I was concerned, and then they could look at the notes and things like that and advise whether or not I needed to come back in again or not. They gave all the advice I needed to be able to stay at home comfortably and to make sure that I understood what was needed to be done.
It was a huge advantage for me being at home and being able to have my own food rather than hospital food. Just that you can eat what you want, when you want, you can eat regularly. My
appetite went quite quickly. So from that point of view, being able to have food that I liked and food that I knew that I could stomach at the time was definitely better.
The other big advantage of being at home is you're in your own bed and you don't get disturbed, and it's just generally more comfortable. But it does mean that your partner or carer has more responsibility. They have obviously to look after you, and during a lot of the period of the chemotherapy you don't feel very well, and so you are very much dependent on other people to go shopping and to feed you and look after you.
If you're considering treatment in ambulatory care, think about all the advantages, all the benefits to you. So you'll be able to stay at home more, you'll be able to be more independent, you'll be able to sleep in your own bed, eat when you want and what you want to an extent. If you have a family, be around your family, sort of be part of family life. So we would advise you to think about all these things and see whether it's the right thing for you.